had a number of goals when developing eBroselow. One of our foremost goals initially was to eliminate the need for humans to do mathematics under stress. That was apparent in the tape, and we have taken this to the next level in eBroselow. When you think about it, even getting a complex mathematical formula correct just increases your stress and should not be part of the process. Nurses should be able to focus on the patient and the problem on hand and not be worried about if they made a mistake. Number two is that medication administration now for adults has become progressively more complicated. There are new recommendations such as ISMP that is saying it's not just enough to know the dose is correct and convert to mils, but you should know exactly how to dilute a medication, you should know exactly the delivery time, and really should know the common serious side effects. So a second goal was to automate that whole process. We wanted to empower nurses. When you get an order from a doctor from a medicine you're familiar with, that's pretty straightforward. But sometimes under stress and when a patient's deteriorating, you're asked to give a medicine that you're not really very familiar with. There may not be an expert at hand to check. And so sometimes you just give the medicine on faith. eBroselow gives you the ability to second check a medication on your own against the standard at any time. We wanted to develop a single standard of care so that inexperienced nurses could function as well as experienced nurses. Adult nurses could give pediatric medications as well as pediatric nurses. Also, we wanted the same standard of care whether you're working during the day where you might have a pharmacist at hand or just at the end of the phone upstairs, or you might be working at night. You may not even have a pharmacist in the hospital. It saves time. It saves about a minute for every medication, but sometimes it might save you 20 minutes because you're waiting for somebody at pharmacy to pick up the phone. So what can you do with this extra time? Well, you can take more time with the patient, you can talk to the family, or even you may have time to get a quick sandwich break when you're working. The bottom line for nurses is that most of these electronic tools have decreased nurse satisfaction. They're for documentation and billing. This is a tool that actually makes your life better, makes you more secure, makes you feel that you're less likely to harm your patient, and should give you more time at the bedside and greater satisfaction with your job.